At SCL Health, we are committed to reducing the stigma related to mental health. By reducing stigma, we can reduce the barriers for people who are interested in seeking health but choose not to. We are always looking at innovative and adaptive ways of providing health care to our communities.
At SCL Health Medical Group Butte, our goal is to treat the whole health of an individual.
I explain mental health a lot of the ways to people using physical health. Doesn't mean that there's something wrong with you, it just means your body's not producing what it needs to.
Untreated anxiety and depression definitely manifests in physical symptoms as well. I think there's this mentality, particularly in Montana, that you need to just suck it up and deal with it.
Holistic care is treating both the physical and mental components. So you're treating both sides of the patient because they are so closely linked.
Typically, I see people weekly or every other week at first, and we can be doing everything from coming up with a schedule to start exercising to looking at what are your thought patterns, how are they contributing to your anxiety, to your depression.
I found out I was pregnant when I was 19 years old. When I first found out, I was kind of, scared. I was on my own, living on my own, and I was the only one paying the bills. After a while, I have come to the point where I was getting very depressed and I got a lot of anxiety. And Elizabeth, I went and saw her every week, if not every 2 weeks, and being able to talk to her was nothing but help, and it pushed me through, and that is partially why I am here today. I see Elizabeth every week, and she's like the highlight of my week. I get to see her, I get to talk things out. It has helped my depression and my anxiety a lot more than I would have ever thought.
Montana might have the highest suicide rate just due to lack of services. It's such a great program. Again, it allows us to provide holistic care to our patients, and so having the continued funding to do that is imperative.
With the integrated model, the other nice thing is that if you pull up in front of any psychiatrist's office, especially in a small town like Butte, everybody knows, oh, Katie's going to see the psych today. The beautiful part about having it within our clinic here is that they walk in and they register just like if they had a cold or if they were here for their annual physical or anything like that. And that really gives people more of an opportunity to not feel like they're being treated differently because they might have a condition that they need a little extra help with. And it really allows people to feel like it's okay to treat their illness as a regular illness.
One thing we've been doing in all of our primary care clinics is screening for depression and anxiety when our patients come through the door. So whether they're here for an acute illness, or they're here for their chronic follow-up, or they're here for their annual exam, we're screening them. So that allows us as providers to identify issues that might be ongoing.
Just to have a full medical team under one roof would be incredible. And them working as a full care team on the full patient's health, I think that would be an ideal world for every patient.
The future of mental health in Montana is bright.